Hello, and welcome to Grade.com Talks With. Today, we're talking with Paige Lindblom, Community Engagement Manager at Children's Diabetes Foundation, an organization dedicated to research on childhood diabetes and to the provision of the best possible clinical and educational programs for children with type 1 diabetes. And if you're new to our podcast, please press subscribe button either on YouTube or your podcast app. Because today, we're going to learn about an organization that is raising funds to support the Barbara Davis Center for Diabetes, where thousands of patients of all ages from all over the world receive the finest diabetes care available. Hello, Paige. Welcome to Grade.com Talks With. We're excited to have you here.
Thank you so much for having me. I'm so excited.
Wonderful. Could you please describe Children's Diabetes Foundation for someone who is not familiar with your work?
Absolutely. So the Children's Diabetes Foundation was founded in 1977 alongside the Barbara Davis Center for Diabetes. Our whole mission is to provide funds for research, patient awareness, and support for patients at the Barbara Davis Center. Our whole role is around that. Our executive director currently is actually the daughter of Barbara Davis. Her name is Dana Davis, who the center was actually founded for back in 1977. So we definitely kept it in the family. Very transparent of why we were founded, and we really just aim to make a difference in those impacted by type 1 diabetes.
Mm-hmm. That's great that Barbara Davis was passionate about finding about the research and providing the best possible care for diabetes. And you mentioned there was a story behind it with her daughter. Now her daughter is running the organization. Could you please describe what does Barbara Davis Center for Diabetes does?
Yeah, so the center is a world-renowned center located in Aurora, Colorado, right outside of Denver, Colorado. And they see over 8,000 patients a year, like you mentioned, internationally as well as in the U.S. So we currently help patients from around 11 countries as well as all 50 states. And most of our population, though, is from Wyoming and Colorado, the states in the U.S. Mm-hmm. But they help with everything from clinic visits to eye vision care to research to everything that possibly goes into the care of a type 1 diabetic, as well as their family. So there's social workers on site, there's pediatricians, there's pharmacists, literally every facet of care that goes into type 1 can be done at the Barbara Davis Center.
That's great that Barbara Davis Center for Diabetes provides the whole range of services and provision, clinical provision for people who have diabetes, type 1 diabetes, and for their families. So it's a great environment where one can come and get the best cure available at the date. And I believe that's wonderful. Your organization specifically focuses on children type 1 diabetes. Could you please describe how widespread is childhood diabetes is?
Absolutely. So first I'll go over signs and symptoms. This is super, super important. I will say too, type 1 diabetes is not caused by race or age or dietary choices. When most people think of diabetes, they think of type 2 diabetes, which is a diabetes that's caused typically by poor exercise habits, poor dietary choices, stuff like that. Type 1 diabetes is at no fault of the family or the child. It is a genetic disorder. We have no idea why it happens yet. We're still trying to figure that out. But so type 1 diabetes is basically where the pancreas, which is an organ in your body that secretes insulin, doesn't do that anymore. Your body, for some reason, attacks that pancreas, that organ that's so important to process energy in your cells, doesn't work anymore. So for those that have type 1, their blood sugar gets super high because they can't utilize the sugar that's in their body and turn it into energy. Symptoms of type 1 include frequent urination, bedwetting if it's previously controlled, weight loss, fatigue, so many things, and especially fruity odor to the breath too. So if there's any symptoms, they say it's not just a glass of water their child's having at dinner and saying, okay, that's a lot of liquid. It's glass after glass after glass of water, like they haven't had water in days. And they go to the bathroom a lot and things are just not messing up or things are not tying into how they should. A simple 5-second blood sugar test at a doctor's office, literally 5 seconds, can save their life before they go into what we call DKA, or diabetic ketoacidosis, basically where the blood turns into acid because of super high blood sugar.
Mm-hmm. Wow. You mentioned that everyone knows about type 2 diabetes, and they kind confuse it sometimes with type 1. And thank you for clarifying what does type 1 diabetes mean, and how it is not reflected based on dietary habits or the exercise abilities, but rather a genetic disease. What are the cures available for children living with diabetes today?
Yeah, so right now we actually don't have a cure. So right now, if you have type 1 diabetes, there is no way to get rid of it. There are, of course, ways to manage it, though, and we've come a long way. So once insulin was discovered in 1921, we've progressively made updates and changes in how that therapy is used. So insulin, again, is that part of your pancreas that secretes and causes energy to be turned into energy. So people with diabetes have to inject that in some way in order to survive. Type 1s typically have to do it 24/7. Type 2s sometimes use insulin, but mostly type 1s. But out on the market today, we have a thing called an insulin pump. An insulin pump is an automated system that has algorithms and all this stuff put into it. So it basically acts like a pancreas the best it can. But a lot of diabetes in your body is not always the same thing. So if it does the same thing every single day, but say one day you go for a hike and the other day you sit at home watching a movie, you have very different insulin needs. So the insulin pump system isn't perfect. Right now, we actually have a new system coming out just in the diabetes market. It's called the automatic pancreas system, or automated pancreas. And the closest thing we have to that is a thing called the continuous glucose monitor, which reads your blood sugar every 5 minutes. And that sends the data to the insulin pump, which then automatically increases or decreases insulin based off of future and current blood glucose. So it's this whole computer algorithm constantly working around the clock, trying to see what your body's going to do with insulin, what insulin needs you're going to have, and trying to make it work in the best way for the patient.
Mm-hmm. Although there is not a perfect cure for type 1 diabetes, the research and the work that organizations such as yours and the other organizations that have been doing and in progressing different tools that can be provided. You mentioned that there was just an insulin, now there was like insulin pump, and now there is a new device that is coming that can make the life of people living with type 1 diabetes easier. Is there a difference between type 1 diabetes in children and in adults?
Interesting question. I kind of like that. So with kids, it's a little bit, I wouldn't say easier, but it's a little bit more obvious with signs and symptoms. So if you have a 7-year-old who wasn't wetting the bed for the past 5 years and is suddenly wetting the bed again, that's kind of a red flag in your head. Lots of water, you can see that. And adults absolutely can be diagnosed with type 1. It's a little less common because typically type 1 is kind of kickstarted with puberty. We think most diagnoses happen between the ages of 7 and 12. So kind of like those more prepubescent going to puberty years. So when you're an adult and randomly type 1 happens, we kind of justify it to ourselves. It's okay, I'm drinking water because I'm dehydrated. I'm going to the bathroom a lot because I'm drinking so much water. And I'm nauseous because I'm drinking so much water. Like there's always these things going on in your head. It actually manages the exact same, typically with an insulin pump or insulin injections and the continuous glucose monitor, as well as a blood sugar meter just to check blood sugar. Really the biggest difference is just the responsibility on the person. Typically for children, their parents can help them carb count. For diagnosed as an adult, though, it's an entire lifestyle change. You go from doing all of these things for the past X amount of years in your life, and now it's okay, you need to learn how to count carbohydrates. You need to learn how to dose for insulin. You need to do all this math now every time you take a bite of food or a sip of a sugary drink. So it's very much different for the adults and kids just based on the lifestyle change that they go through. Kids are very flexible and able to adapt to a lot of situations, while adults are a little bit hard-headed, I would say, too. So when this change happens, it's more difficult, I would think, for a lot of adults because it's a total lifestyle change and change everything they're going to do from now on.
Yeah, the contrast is quite obvious and quite different that you mentioned. Children are usually flexible, they're adaptable, and they always have their parents to take care of them. Once you're an adult, you are on your own and you have to do everything. You have to take responsibility for your own actions. And sometimes your environment, work environment, other abilities don't let you to change your lifestyle right away. So it might be more challenging and there might be more obstacles on your way. How can parents raise their children or prepare their children who have type 1 diabetes to adulthood, that in a way that diabetes doesn't become an obstacle in their life, but rather just a part of their life that is having something having, I don't know how to perfectly describe it, but having a scar, for instance.
No, absolutely. And I love this question too. So I personally have type 1 diabetes. I was diagnosed when I was 8 years old. I had all the symptoms I mentioned before, the frequent thirst, going to the bathroom a lot, fatigue, weight loss, everything. I had it all. Luckily, my parents caught those symptoms. And I've been using insulin very happily. I've been an athlete. I've done all these things in my life despite having type 1 diabetes. I would say with the transition into adulthood, it's all about empowerment. It's saying, okay, I know you're an 11-year-old child, but how about we try counting our carbs by ourselves? Can we do an injection by ourselves? Can we test our blood sugar? Things are always going to go wrong. And I know that sounds really harsh, but diabetes isn't perfect. And even if you get the carb count right and the insulin right and the sun is shining and life is good, something usually happens. And that can be passing out. That can be a seizure. That can actually be death for a lot of these people. So it's kind of hard to give up those reins when you're doing so well yourself. So I would say try to do little steps of empowerment. Try to, again, say, okay, I know you're going to do awesome with this injection. I trust you to do it yourself. I'll sit here with you while you do it, but it's super important you learn how to do this. And kind of doing baby steps up until there. So you prepare your child to be without you someday. And when, like, I've had kids that go to college and their parents have basically what I call babied them their whole life. And they don't know how to do a lot of these things by themselves. So they're constantly calling mom, constantly calling dad, asking how to count a carb or how to read the food label, how to give their injection by themselves. And it's best to empower these children to know they can do this. And when I was even, I think, 3 days coming back home from the hospital, I was doing injections by myself. And my parents worked really, really hard to make sure I had the tools and tricks that I needed to do to be able to be healthy, but also a happy young kiddo. And I think it's the best thing for parents to do is try to keep that lifestyle and keep everything as normal as possible. But diabetes, just a little asterisk at the end of the child.
Wow, your story is very inspiring. Despite having type 1 diabetes, you were an athlete. You took the responsibility for your life, and your parents were all provided you with necessary tools to make the transition as easy as possible. And you were able to do insulin pumps on yourself by yourself, and it made you more independent. And that's wonderful. And I'm inspired by your story, and I think you can be a great role model for children who have type 1 diabetes, that type 1 diabetes doesn't define you, and you can take precautions, and your parents can prepare you to an adulthood to make the transition as easy as possible for you. You mentioned that there is a constant research going on type 1 diabetes, and type 1 diabetes has been discovered for quite a while. And why there hasn't been a cure so far? Why has it taken so long?
You are preaching to the choir. I ask myself that question every day. It's been, I can't speak much for research. I am no scientist. I am no doctor, and I wish I could have that mindset, but I am not. Insulin was first discovered back in 1921 by Frederick Banting. They actually used dog pancreases and did this gruesome process of shredding it up and juicing it and all this stuff to get insulin, but it started to save lives. So we've kind of moved on from that, luckily. Now we have full synthetic insulin that's created in a lab, which is great. We also have insulin pumps and CGMs, and we're constantly getting ways to improve the care of diabetes. But the hardest thing about diabetes is we still don't know the why. Until we know the why, we can't fix the problem. For everybody, it's different. My personal belief is it's trauma. I broke my arm about 3 to 6 months before my type 1 diabetes diagnosis and almost lost it. And then I personally think, like I said, it's trauma. So that trauma of breaking my arm caused diabetes in some way. But for some kiddos, it just happens. For some adults, they're in their 20s and it just happens. Puberty, yes, is a factor, but why would someone in their 30s or 50s get type 1 diabetes? We still don't know what the common trigger is. And until we figure out that common trigger, we can't fix the problem because we don't know why it happens.
Mm-hmm. Now it makes sense, because everyone's situation, everyone's symptoms, causes are quite different. So it's you mentioned there is not a common denominator that can combine it all, so their research can be easier. On your website, it indicates that your foundation, Children's Diabetes Foundation, you have several programs for children. Could you please describe those programs and the scale and the impact of those programs on the children?
Absolutely. So I'm going to start with ones that are completely funded by donors. So this is our Helping Hand program. The Helping Hand program has been around for quite some time, and it helps Barbara Davis Center patients afford insulin, syringes, co-pays from their insurance, because insurance is definitely an issue in the US, but afford their co-pays, everything that goes into care. That is a huge program that we utilize. It literally makes a difference between life and death for these patients of being able to afford their insulin and afford to see their endocrinologist every year. We also have a program called Helping Little Hands, which is for pregnant women that have type 1 diabetes. We help them again with co-pays with insulin, as well as getting a CGM, or the continuous glucose monitor. That helps them be able to see where their blood sugar is going, because as a pregnant woman, if your blood sugar is too high or too low, that can severely harm the baby once they're out of utero. So it's super, super important for them to be able to manage their care and be as healthy as possible to ensure the future health of their child. I will also say our holiday assistance program that provides meals as well as gift cards for families that are at or below poverty level, that are patients at the Barbara Davis Center. And this is every Thanksgiving and Christmas, this program. So last year was one of our biggest jumps. Again, we think due to COVID, we had over 200 families have to have holiday assistance this year just to be able to have a Thanksgiving turkey or a Christmas ham on the table. So that's a really big program. It's having more and more increases in costs every year, especially presents for the children. It's super, super important to have a sense of normalcy, even though type 1 is still in the family. And lastly, I would say our CDF Advocate program. I actually run this program myself. It's for kiddos age 6 to 22, all who have type 1 diabetes. And we meet a couple times a month or once a month, once a quarter, kind of depends on the year. Again, COVID's very different, but typically meet in person. And we do everything from talking about type 1 diabetes to schools, to passing out materials about signs and symptoms, to just having social events so these kids have a sense of normalcy throughout the year. Constantly as a type 1 diabetic, I feel like we're put to the side. It's, oh, you can't have this, you can't eat this food, you can't be in this activity. But it's more so empowering these children to speak up for themselves and say, yes, I can, I just need to dose insulin for it and we can move on. So this program, a lot of our programs are, yes, financial based, but also emotionally based, and being able to take care of every aspect of a person with diabetes, not just the diabetes part of their life.
I like the fact that you have a range of programs that include both provision of clinical help for children and families and pregnant women living with type 1 diabetes, but as well, you take on responsibility on supporting emotionally the children from 6 to 12 age, especially in that critical time of their life where their personalities is building, and you raise their self-esteem, their self-confidence, and empower them to realize that they can do anything in terms of athletics, and they can reach their goals if they keep working despite having type 1 diabetes. If someone would like to support Children's Diabetes Foundation, how can they do that?
Yeah, so you would visit our website. It's a super long website, so I apologize, but it's childrensdiabetesfoundation.org. There's information on our programs, our mission statement, who's on our staff, how to contact them, as well as how to donate. And one of the best things I would say about CDF is when you donate to us, you can actually choose where you want your money to go. It's not just a blanket donation saying, okay, here's $40, go wherever. It can be used on anything from staff lunches to gas money to hopefully research. But with us, it's different. You can say, I want my money to go to research. I want my money to go to the Helping Hand program. I want my money to go to holiday assistance. And you can choose exactly where that money is going to go. We will not deviate from that.
Mm-hmm. For you listening, the link to the Children's Diabetes Foundation website will be provided in the description, so you can go, and if you would like to donate and familiarize yourself with all the great programs that Children's Diabetes Foundation is offering and providing, you can do that. Thank you so much, Paige. It was wonderful to get to know Children's Diabetes Foundation and you, and your story is inspiring.
Thank you so much for having us. We sincerely appreciate it, and hopefully we can do this again soon.
Wonderful. For you listening, if you enjoyed this conversation, please press like and share button, either on YouTube or your podcast algorithm, because this will show that this conversation is important, that we need to support organizations that are supporting children living with type 1 diabetes in terms of both clinical and emotional help. Thank you and see you in the next episode.